Hi everyone, I'm Laura, and in this video I'm going to tell you 5 tips to maximize the effect of using Tadalafil in the treatment of erectile dysfunction. Erectile dysfunction is a very prevalent condition in our society. It is estimated that 10% of men under 40 will experience this condition at some point in their lives, and approximately 30 to 50% of men between 40 and 70 will receive this diagnosis at some point in their lives. The primary treatment for erectile dysfunction is the use of 5-phosphodiesterase inhibitors such as Tadalafil and Sildenafil, which are vasodilator medications that work by increasing blood flow to the penis, improving firmness and rigidity for sexual activity. It is common for many patients to complain that Tadalafil is not as effective as before or has stopped working. Often patients take it incorrectly or need to adjust some aspect of how they use the medication. I will now share 5 tips that you can adapt to using this medication. Here we will primarily focus on on-demand medication, which is used only on the day of sexual activity. The first tip is to purchase quality medication. A very common question is whether generic and brand name medication have the same effect. It's important to understand that quality can vary. It is important to use medication that is trustworthy. If the generic manufacturer is trustworthy, and if you have used it before and believe in the effectiveness of the substance, then it's okay to use it. However, when using medications that have such an immediate effect for evaluation, it is very important that the medication is of high quality. For example, urologists often recommend ZAD or Cialis to patients. They have no ties to the industry, but know they are reliable medications. Tadalafil is sold in 2 dosage strengths, 20 and 5 milligrams. The 20 milligram dose is intended for use only on the day of sexual activity. This medication in the 20 milligram strength does indeed have a more potent effect. It can last up to 36 hours in the bloodstream, depending on the quality of the medication and its absorption in the patient's bloodstream. The second tip is to try taking the medication on an empty stomach. Many patients associate Tadalafil use with, for example, alcohol intake or even the consumption of copious high-fat meals. Both alcohol and meal consumption are associated with reduced absorption of this medication in the gastrointestinal tract. Therefore, this can decrease the medication's effect. So if you are experiencing this type of issue, if you feel the medication is no longer effective, try using it on an empty stomach. The third tip is to seek sexual stimulation along with taking the medication. And here, we emphasize to patients that it's not just about taking the medication an hour before sexual activity. The patient cannot take the medication and go to sleep, read a book, or watch a soccer game. They necessarily need to generate stimulation for the erection cascade to be triggered. Sexual stimulation begins in the brain. It is neurological, so the patient necessarily needs the sensory stimulation, whether it's touch, smell, feel, whatever they find best. The fact is they need to take the medication and seek excitatory stimulation. Fourth tip, using the correct dose of the medication. And here, when we talk about 5-phosphodiesterase inhibitors, we have Tadalafil and Sildenafil. The 20 milligrams dose of Tadalafil is the dose for use before sexual activity. Many patients think the 5 milligrams dose has the same effect. The 5 milligram dose is for treatment. It is for daily use regardless of whether the patient intends to have sexual activity. Therefore, this 20 milligram dose is the most indicated for maximum effect. Furthermore, Sildenafil, which is the popular little blue pill Viagra, is available in 25, 50, and 100 milligrams formulations. Each patient needs to adapt the dose used to their individual situation so that the desired effect of the medication is achieved. Fifth and final tip, the time between taking the medication and desired sexual activity. Often patients use the medication 30 to 60 minutes before sexual activity. A tip here is to try using it 1 to 2 hours before sexual activity. Tadalafil, as I mentioned, works for up to 36 hours. It maintains this vasodilatory effect for up to 36 hours. However, we know that its peak effect is within the first 10 hours. So aim to use the medication at least 2 hours before your sexual activity and use it primarily within this window to benefit from the maximum effect. After the first 10 hours, it is more easily cleared from the bloodstream. And listen, before we finish, there's something important. If even after following all these tips, you still feel that the medication's effect isn't the same as before, or that you're lacking that extra boost when needed, there is a 100% natural alternative that has been drawing the attention of specialists worldwide. A simple 7-second ritual done at home that has been helping thousands of men restore their potency, confidence, and desire without needing to rely solely on pills. If you want to learn more, just point your phone's camera at the QR code on the screen or click the pinned link here in the comments. This video could be taken down at any moment, so act now and watch while it's still available. If you found the content of this video interesting, if you think it will help someone you know, please share this information. Don't forget to subscribe to our channel and activate notifications to stay updated on our weekly content. Best regards and see you soon.